I'm Conny Mosley. I'm a boarded anesthesiologist. I work in a specialty clinic in a veterinary of mainly small animal in north of Toronto, and I do run a pain clinic where I treat mainly dogs and cats for chronic pain. I've been trained, my residencies were University of Washington State in Florida, and then I had a couple of faculty positions, and now I'm in a specialty clinic. So in my pain clinic, I do see a fair amount of patients or owners of patients that are asking for a cannabinoid medicine or put their dogs or cats on cannabinoid medicine. So seeing them as part of the integrative approach to adding more pain medication, trying to figure out what is working for those refractory pain cases, we do see a fair amount of that. From the effectiveness, it really depends on how the owner approach the use of cannabinoids. If they take products out from the black market or just from resources where we don't really know where they're coming from, I see cases where it works not quite as efficient. Sometimes it works well. Owner's perception is always, has a little bit of a bias on there. Because my patients are mainly on a bunch of drugs, because when they come to my pain clinic, they often are very refractory. They are on gabapentin, they are on NSAID, they are on all sorts of other supplements, and then adding some cannabinoids might make it a little bit difficult to figure out what is working and what isn't working. When we really guide how they're using the cannabinoids in either their dogs or cats, I feel like we do see quite an effectiveness depending on the product. I find when we're using CBD only products, because owner perception still is that this is the safest way to use cannabinoids, the effect is it varies depending on the dog, on the other medication. Sometimes I feel even if it is females or male dogs respond different, but I find it very varying. When there's a more of a multi cannabinoid product where, for example, CBG would be in there, like a low dose of THC, the effect is quite significantly an improvement. The big problem of where owners get their information from on what kind of products to use for cannabinoid for their pets is that there's very limited resources. The CAVCM has a website where they can go to, but usually I find they get it from their social media sites, from their friends of a friend of a friend, the groomer, or anyone else who kind of used it or has a friend who used it, and trying to get the information from that, which makes it a little bit hard. That is the same problem that we see when they choose a product. Because they're very limited available, it is hard for them to resource it out, and then the information of what they need to look for in a product isn't out there too. As veterinarians are a little bit reluctant to give out that information because of the initial the initial kind of way where everyone said we can't talk about it. It seems that fear is still there, and we don't, and most veterinarians are not very knowledgeable about it, that I feel like they don't really want to answer that. So we have to shift that mindset in veterinarians to actually kind of be informed and be able to give that information to the owners, to be able to then say, let's look at a product that really is a good product and being effective. In Ontario, we're only allowed to recommend legal products, so that would mean Ontario Cannabis Store products, which are mainly recreational products, and all we know about them is what content of THC and CBD is in there. Sometimes they will tell you what terpenes are in there, but that's all we know. So it is kind of hard to find the right product. In the different provinces in Canada, it is kind of a little bit different, but we still are all in that similar boat, not being able to have a really good product that is adequate for specific diseases, like when we say we're looking at seizure animals, or we kind of looking at pain patients' immune-mediated diseases to then say, let's specifically look at that product that we can prescribe for that disease. The question if other medications or have any side effects with the cannabinoids together is kind of multifold, and like we don't actually know the 100% the answer of that quite yet. We need to do more research looking at that. We always know that CBD will block the P450 system, that it will therefore decrease or increase the plasma levels of other drugs like gabapentin that might use the P450 system as well. And we might see the side effects of the gabapentin, which can be more sedation, especially when high doses are used, when we add cannabinoids to it. When we look at the studies, for example, the one from Colorado, kind of combining the anti-seizure conventional anti-seizure medication with cannabinoids, clinically it didn't really seem to change the plasma levels. They looked at those ones and it doesn't seem to make a difference. So if that is a very human-based thing, if our pet population like dogs and cats do the same, we don't quite know yet. I find clinically with my patients, because they're very old, when they are on doses of gabapentin, not even very high doses, and we're adding a CBD mainly or a high CBD content product to it, the sedation with the gabapentin can be seen, but again we need to look at the different pharmacokinetics in that way to really answer that question. But because pain management is very individual anyway, some dogs or some cats metabolize things very different or react to things very different than others. I think it is very important to always remember, use your individual approach instead of like just giving doses out and see how they respond, and then dial it up or down on the different multimodal ways of doing pain management, because we know we have an integrative approach with different modalities that include non-pharmaceutical or nutraceutical components to it, as well as a combination of different drugs or nutraceuticals that all can kind of like affect the metabolism of the animal.